a model of the knee joint. The knee joint has three compartments: the superior or the top compartment, the outer compartment of the knee joint, and the inner compartment of the knee joint. There are three bones involved: the patella or the kneecap, the femur or the thigh bone, and the tibia or the leg bone. The blue structure that you are seeing on the lower portion of the thigh bone is the cartilage, which when it wears and tears because of age or degeneration, you start getting pain. The upper portion of the leg bone is also cartilage, and to protect this cartilage we have two shock absorbers which are called the menisci, the lateral meniscus and the medial meniscus. They actually take all the load of the knee joint and distribute it evenly so that no one particular structure is loaded too much. There are four ligaments in the knee joint. The front ligament called the ACL or the anterior cruciate ligament, the back ligament or the PCL or posterior cruciate ligament, and there are two ligaments on the side. One is called the lateral collateral ligament or the LCL, and the medial collateral ligament called the MCL. All these four ligaments give support and balance the knee joint in all kinds of movements and rotations of the knee.